What if the free healthcare Canadians depend on isn't as free as it seems? And what if Americans aren't as behind as they think? Chapter 1. The Myth of Free. Many people believe Canada's healthcare is completely free. In truth, it is publicly funded, not free. Canadian taxpayers pay for it through income taxes, sales taxes, and provincial premiums. The average Canadian household contributes thousands each year toward healthcare, whether they use it or not. The idea of free healthcare misleads many into thinking Canada has solved access, cost, and quality issues. In reality, wait times are long, some services aren't covered, and supplemental insurance is often needed for dental, vision, or prescriptions. By breaking down your annual tax statement, you'll see that healthcare is one of the largest public expenses. Canadians don't pay out of pocket at hospitals, but they do pay, invisibly and consistently. Understanding the real cost is the first step to understanding how the system works and what makes it better or worse. Chapter 2. Access and Wait. Times. Canada's universal coverage guarantees access to care. But getting that care on time? That's another story. Wait times for specialists, surgeries, and diagnostic tests can stretch for months, especially in rural provinces. Compared to the US, where you can get a private appointment within days if you can afford it, Canada's wait times raise concerns about the quality of access. For example, a patient might wait 8 months for a knee replacement, which could mean prolonged pain, reduced mobility, and economic hardship. Emergency rooms also face overcrowding. A non-urgent patient might spend 6 to 10 hours waiting to be seen. The reason? A shortage of staff, funding bottlenecks, and the absence of a private option to relieve pressure. So while Canada ensures no one is turned away due to money, the delay in service raises questions about equity and experience. Chapter 3. Quality of Care. Despite delays, the quality of medical care in Canada is generally high. Doctors are well trained, hospitals meet international standards, and public trust in the system remains strong. But the system can't be perfect when stretched so thin. One major advantage is that medical professionals are not incentivized to overtreat. In the US, the profit model sometimes leads to unnecessary procedures and inflated billing. In Canada, the goal is care, not profit. However, Canada struggles with innovation uptake. New medical technologies and treatments are often slower to be adopted due to funding approval delays. In essence, Canada prioritizes stability and universal access, while the US prioritizes speed and cutting-edge innovation for those who can afford it. Chapter 4. Prescription drugs and what's not covered. Unlike hospital visits or doctor appointments, prescriptions are not universally covered in Canada. This is where many Canadians feel the gap. Provinces like Ontario offer some drug coverage for seniors and youth, but others fall through the cracks. Many Canadians rely on private insurance through employers to fill these gaps. Without that, the cost of essential medications can be a significant burden. Dental, vision, and mental health support are also largely uncovered. A Canadian without insurance might pay $200+ for a dental cleaning or therapy session. These blind spots force many to delay care. So while Canada offers a strong foundation, its coverage is far from complete. Chapter 5. The US Comparison. In the US, healthcare is largely private, meaning access is fast if you can afford it. But millions remain uninsured or underinsured. Medical bankruptcy is a real fear. In Canada, no one goes bankrupt from a hospital stay, a powerful reassurance. Still, Americans have more choice. You can select your doctor, compare providers, and even negotiate. Canadians often have fewer options and must wait. One country offers speed and technology at a cost. The other offers equity and protection with limitations. It's not a matter of better or worse, it's a trade-off. The challenge is finding the balance, a system that is both fast and fair. Chapter 6. Rural versus Urban Divide. Access to healthcare isn't just about national policy, It's also about geography. In Canada, rural residents face severe shortages in doctors, nurses and specialists. Clinics may be hours away. Telehealth has improved access, but it can't replace in-person exams or emergency care. The urban-rural gap results in unequal healthcare outcomes. Urban Canadians may wait 3 months for a specialist. Rural Canadians might wait double that or travel long distances. This disparity mirrors a global problem. How do you deliver equal care to unequal geographies? Chapter 7. Mental Health Services. Mental health care in Canada is critically underfunded. Long wait lists, limited public services, and costly private therapy mean many suffer in silence. Programs like KMH in Ontario are groundbreaking, but under-resourced. Youth mental health in particular is reaching crisis levels. Insurance rarely covers therapy. A single session can cost £150 to $250. Community programs help, but demand exceeds supply. The system must evolve to treat mental health like physical health, essential, urgent, and worthy of full public funding. Chapter 8. Immigrants and Access. New immigrants to Canada often face a 3-month wait period before they can access provincial health care. During that time, they must pay out of pocket or buy private insurance. Language barriers, cultural disconnects, and unfamiliarity with the system also make access difficult. Many newcomers delay care due to confusion or fear. Community clinics try to bridge the gap, but are often overwhelmed. Equity in access means not just offering services, but making sure people know how to use them. Chapter 9. What Canada Gets Right. Despite challenges, Canada's system has strengths. No hospital bill, no refusal due to pre-existing conditions, no bankruptcy due to illness. That's powerful. The public model prevents profiteering, keeps costs predictable, and supports preventive care. Vaccination campaigns, health promotion, and chronic illness management are centralized and efficient. With reforms in speed, mental health, and coverage gaps, Canada could build the world's best system. Chapter 10. What Needs Fixing. Canada must shorten wait times, improve rural access, expand drug and mental health coverage, and embrace innovation faster. That requires political will, increased funding, and smarter management, not privatization. Transparency, better digital health records, and patient-first policies can modernize the system. Healthcare isn't just a system, it's a promise. And that promise must be kept for all Canadians. Free healthcare isn't perfect, but neither is paying thousands to survive. Canada's system has cracks, but it also has a strong foundation. The real question isn't whether it's better. It's, how do we make it the best? Subscribe to Buy Canada First for more deep dives into what shapes your life and wallet in 2025.